Hello everybody. Welcome back to the second episode of my podcast, The Health Talk with Dr. Sagorika Malik. Today we will talk on an extremely common and important health problem. It is easy to diagnose and very simple to treat. But if left untreated, it can lead to serious complications and even a heart attack. We see it quite commonly in women, but sometimes even men show it too. What do you think? What am I talking about? To tell that, I will start with a case. Gauri, a 17-year-old girl, visited my clinic with her mother. Gauri's main complaints were she was having severe fatigue and she was getting breathless with minimal activity. Her periods had also stopped for the last 2 months. Now that worried her mother and she rushed Gauri to my clinic. After some probing, Gauri admitted that she was having these symptoms for the last 6 to 8 months. Gauri is from an upper middle class family and is a vegetarian. She is slightly overweight, so she was trying some fad diets for 1 year to reduce weight. Her mother actually came to me with some blood reports, and the most alarming thing I noticed was her hemoglobin. It was only 7 grams. Gauri was suffering from iron deficiency anemia. So, what is iron deficiency anemia? Hemoglobin is present in our red blood cells. It is extremely important as it carries the life-giving oxygen to all the parts of our body. Normally, every day, few of the cells die and new cells are made by our bone marrow. To make this hemoglobin, our bone marrow takes the iron from our body stores. But sometimes we can't make sufficient hemoglobin due to deficiency of iron in our stores. And then we'll end up with iron deficiency anemia. Now let's see who are more prone to suffer from anemia. Nearly 80% of women and about 20% of men suffer from anemia. In women, it is seen in all age groups. But in men, we usually see this deficiency in the extremes of age. Plus, it is more commonly seen in vegetarians as the iron from the vegetarian food is more difficult to digest and absorb. We say a person is anemic based on the hemoglobin levels. So, at what level do we call it anemia? Normal levels of hemoglobin is between 12 to 15 grams for any adult. Between 10 to 12 grams of hemoglobin, we call it mild anemia. Between 8 to 10 grams, it is moderately severe anemia. And we may start seeing some symptoms here. Less than 8 grams is severe anemia. Here, people show quite a few symptoms. And less than 5 grams is life-threatening. This needs hospitalization for treatment. Why do you think anemia is neglected? Because it doesn't give clear symptoms. So, let's see what we should be looking out for as symptoms. Since anemia develops gradually, in the beginning, you may not have any symptoms, or they are so mild that you may actually miss them. But as your anemia gets worse, you start showing some symptoms. You may notice fatigue, weakness, dizziness, headaches, feeling of chillness, brittle nails, excessive hair fall, swelling in the face, hands or feet, especially on prolonged sitting or standing, sometimes rapid heartbeat or palpitations, even at rest, and sometimes shortness of breath or chest pain, especially when you're doing some physical activity. Now, let's understand why we get iron deficiency anemia. If we think logically, then there are mainly 4 reasons. First, we're losing too much blood or iron, more than what the body can replace. Second, we need more than the regular levels of iron. Third, we are not getting enough iron from our food. And fourth, we are not absorbing well what we are eating. Now let's take the first reason, losing more blood. This is the prime reason for women as they lose blood every month in their periods, especially if the periods are heavier, longer or more frequent than normal. In men, this reason is not so common. But if they are somehow losing blood, like from bleeding piles or ulcers, then they can also land up with anemia. The second reason was higher need of iron. This is applicable to pregnant women. That's why all pregnant ladies are given iron supplements routinely during their pregnancy to support the developing baby. Maintaining good hemoglobin is necessary both for the mother and the baby's health, because anemia can lead to low birth weight babies or premature deliveries. And severe anemia can even lead to pregnancy loss or death of the mother during delivery. The third reason was not getting enough iron from food. Now, body absorbs the iron in animal-based food 2 to 3 times better than the iron in plant-based food. So, vegetarians or vegans need to choose good vegetarian sources of iron to make sure they get enough. All green vegetables, leafy vegetables, beet, all parts of the banana tree like stem, flower and raw banana are high in iron. Fruits like apple, banana, grapes, dates, pomegranates, basically all fruits that turn black on cutting are high in iron. Secondly, your body absorbs iron better when you eat them with foods that have vitamin C like oranges, amla or gooseberry and tomatoes. Fourth reason was problems absorbing iron. Now, certain health conditions like worm infestations, chronic acidity, ulcers, and irritable bowel diseases reduce the absorption of iron from food. Plus, nowadays, gastric bypass surgery for weight loss is becoming quite common. This reduces your capacity to absorb iron. When I started my talk, I had said that anemia is easy to diagnose. So let's understand how your doctor will diagnose anemia. Your doctor will ask your medical and diet history. For women, menstrual and pregnancy-related history becomes very important. Basically, your doctor would like to assess whether you have any of the 4 reasons mentioned earlier which makes you more prone to anemia. If they suspect anemia, then they will ask for the simple blood test called complete blood count. If it shows low hemoglobin, then based on your history and symptoms, your doctor may ask for some additional tests to find out the cause of your anemia, because treatment depends on the cause. Okay, now that we know how to diagnose anemia, let's see how it can be treated. Again, treatments will be advised based on your medical history, symptoms and level of hemoglobin. Mild to moderate anemia is treated with simple iron supplements in the form of pills or syrups which can be taken orally. Your doctor will tell you how long to continue the supplements, and of course, iron-rich diet will always be advised along with the supplements. Now here I would like to give a very important tip. You need to continue taking your iron supplements for about 4 months more after your hemoglobin reaches normal levels of 12 grams. This is absolutely necessary to build up your body stores, because by the time you start developing anemia, your body stores are nearly empty. If you don't take this extra iron, then your hemoglobin will again fall back to the original low levels within the next 3 to 4 months. In addition to iron supplements, your doctor will advise treatment based on your cause of anemia. So let's come back to my case today. What do you all think? How severely anemic is she? Do send me your suggestions and answers on my mail ID sagorika@thehealthtalk.co.in. I would love to hear from you. You can also connect with me at @Sagorika Malik on Facebook, Instagram or YouTube. All the links and details are given below in the show notes. We have now come to the end of this episode. I hope you enjoyed listening to it as much as I enjoyed talking to you. Do click on the subscribe button on whichever platform you're listening to. This will ensure that you will get all my next episodes automatically as and when I publish them. Finally, please share my podcast, The Health Talk, with your family and friends. It may help someone somewhere. I will catch you next week on my next episode. Here, I will be interviewing someone who has worked with underprivileged women at the grassroots level. From the interview, we will get to know how some simple changes can bring in long-term benefits not only to you but to the whole family. Thank you for listening. Be safe and stay healthy.